Hi, I'm Dr. Juma. Welcome back to my channel. So this is the first in a series of videos on the condition osteoarthritis. Please remember that this video is for informational purposes only. Before we get started, we'll set the scene by telling you a quick story about one of my patients. So Joanne is a 65-year-old woman, and she came to see me last week after about a year-long history of a grumbly knee. She's seen her doctor a few times about it, her GP, who's sent her away for 2 or 3 steroid injections. She does get some relief after the injection, maybe for about a month, but the pain always seems to work its way back up again. Eventually, her GP, after having ordered some x-rays, sent her over to see a specialist. And she spent about 8 minutes in the specialist's private rooms. Maybe half of those he spent scratching his beard and looking through her x-ray report before putting it down and declaring, "I'm sorry, Joanne, you've got advanced osteoarthritis. It's practically bone on bone, and all I can really offer you is a total knee replacement." So Joanne comes and sees me. She's saddened by this news, of course. She doesn't really want to go and have such a major operation, and she doesn't quite understand what's happened here. Why does she have osteoarthritis? She doesn't have any past sports history, and it's only been really grumbling away and hurting for about a year. So how could it be so severely damaged? Now, I'll be honest, I've made up the patient story, but I'll tell you something. This is something that I see every single week in my clinic. Osteoarthritis is such a common problem that symptomatic osteoarthritis, so the stage where it becomes painful, is prevalent in over 10% of the population in Australia. As of 2020, 50,000 hip and knee replacements are being performed every single year in Australia. And it's expected that over 2 million people in this country are suffering with the condition. 2/3 of people who have osteoarthritis as diagnosed based on imaging are actually under 65. The vast majority of them, however, are asymptomatic. It's super common, and if you don't have it, you probably know someone who does and who's struggling with it. So what's going on here? Why do we have so many patients who have this degenerative condition? Why is it so common? Why is it increasingly more common? Why is it that there's such a discrepancy between what the patient reports in terms of their function and their symptoms compared to what their images actually look like? Why is it that the only option that they seem to be offered are steroid injections, which maybe put out the fire for 6 weeks or so, or a total knee replacement, essentially removing our own natural joint and replacing it with metalwork and plastics and ceramic? Surely there's more going on here than meets the eye. Well, the first big myth that we have to dispel is this notion that osteoarthritis is purely a wear and tear condition. It's simply not true, and there's a big body of evidence now supporting the fact that osteoarthritis is in fact a low-grade inflammatory condition. It's a disease and a failure of the synovial component of our joint, which essentially makes up the capsule that surrounds the inside of the joint. So let's do away with this notion that our bodies are like car parts, a suspension which has a certain number of bounces in it before it eventually capitulates and wears down. That really isn't the case. Our bodies are finely tuned machines, and every single component within us will take some damage, but also has a balance where it tries to grow and repair. In fact, loading up of our muscles and bones, we already know, if we've ever been to a gym or done any exercise, is a way to damage them in order to increase their strength and resilience over time. And this is no different in our joints. Our joints are designed to take load. In fact, they love it. Our bones and our cartilage like a bit of impact, and they like to move throughout range. What they don't like, however, are shear forces. So for example, this is okay, this isn't, this sort of grinding motion. On weight-bearing surfaces where we have shear forces, particularly in patients who've got a history of excessive overloading, perhaps they've had a history in elite sport, those are the areas which seem to take the most damage. When I say damage, this is usually a balance between deterioration of the cartilage, but also growth and repair, which is a constant component. There's always a balance between compounds and enzymes which degrade cartilage inside of our joint and growth factors which help support them. And this is usually finely tuned and imbalanced. When we have inflammation in the joint, and particularly this failure of the synovial component, which I mentioned earlier, this is when there will be an imbalance between the catabolic factors, those that break down the cartilage, and those that help heal it. And this is how we can lead into this pattern of osteoarthritis. It's important to know this because we need to realize that the cause of this systemic inflammation is actually increasingly well established. There's no doubt that the most significant risk factor in osteoarthritis is obesity. And this is not just the case of having too much weight or carrying too much load, but rather because of the inflammation caused in our joints and in our body as a result of carrying too much fat. Metabolic syndrome, age-related inflammation, and other chronic stressors can all play a part, and I'll touch on these in future videos. So the take-home message for this first point is to do away with this notion of wear and tear. The next really important component to consider, and this is something that I touched on in Joanne's story, is this seeming disharmony between what we see on X-rays and MRI and what we actually feel and what's happening with our function. The reality is, and there are loads of studies to back this up now, that there isn't a correlation between how much damage there is on your X-ray and MRI compared to how you feel and where your function's at. I've had patients come in with horrendous looking X-rays where the bone has completely remodeled and collapsed into itself, and they get on fine. There's no pain. On the other hand, I've got patients who come in bemoaning their osteoarthritis, in severe pain, unable to get up and down stairs, can't keep up with their kids anymore. And when you look at their X-rays, they've got maybe only mild changes. And so the first question that this begs is, why is osteoarthritis defined by the radiographic changes? So as doctors, we learn that osteoarthritis is defined or diagnosed based upon what your X-ray shows. And there's certain changes of bone remodeling and cartilage wear that we look for. But as we've just discussed, how relevant to you are these anyway? They seem to be very relevant to the specialist, deciding whether or not they can justify completely replacing your knee. But as far as you're concerned, I imagine most patients just want less pain, more function, slightly better quality of life. Now, none of this, of course, is to say that we shouldn't be replacing osteoarthritic joints. Hip replacements in particular have some really good patient satisfaction outcomes. And whilst it's not quite the same with knee replacements, I've seen plenty of patients who are really happy with theirs. The point I am trying to make here, however, is that it seems as though the patient has been disempowered and their ability to understand their condition and manage it themselves has been taken away. And this is something that I want to reverse. So let's wrap up today's video by talking about what the significant key risk factors are for osteoarthritis. In future videos, I'll touch more specifically as to how we can manage osteoarthritis by addressing these various factors and what kind of exercises can help as well. So as I mentioned before, whilst mechanical load has a really important role to play in osteoarthritis, it isn't the be-all and end-all. And there's one really important point to make here. Impact and range of motion are actually quite good for us. It's the shear forces that cause damage. And so where do these shear forces come from? Well, it could be that you've previously injured the joint or the stabilizing ligaments around it. As a result, you may have some joint incongruity. Perhaps the joint doesn't quite line up well enough. Perhaps you're collapsing into your knee or your foot or your hip in a way that isn't supported. Joint incongruity and malalignment may be due to a previous injury and damage to the supporting static structures, ligaments, labrum, etc. But in my experience, one of the most common causes for this in the vast majority of patients is simply muscle weakness. Our muscles, and particularly the muscles which wrap around joints, the cuffs of muscles. You may have heard of the rotator cuff of the shoulder. We have a cuff around our hip, and we have many muscles which wrap around all of our joints. They have a job in stabilizing our joints as well. And when they are weak, particularly after we've become fatigued, then this can lead to an altered joint environment and increased shear forces as well. Next is chronic inflammation inside the body. As I discussed earlier, obesity is a significant risk factor, and there are many studies that show that in fact losing weight is one of the most evidence-based and effective ways to reduce your osteoarthritis pain. One study showed a 50% reduction in patient-reported pain with a 15% reduction in weight. Many studies support the notion that obesity is the primary risk factor. And so if there's anything we can do to reduce our weight, it has to be addressed. Other causes of chronic inflammation include anything which puts a stress on our body. For example, this can be from our diet if we're eating highly processed foods which are difficult to digest. This can come from our lifestyle if we are introducing toxins into our body, not just from our diet, but perhaps through smoking or chemical exposure. This can come from our mental and psychological health. If we're under a lot of emotional stress, anxiety and depression are shown to increase levels of inflammation inside of the body. Often overlooked, our sleep is so essential in regulating our stress in our body. I hope you found this video useful. The key take-home message that I really want to deliver is to do away with this notion of wear and tear with osteoarthritis. We're not bicycles, we're not cars, we don't have these springs that eventually wear out. And this notion, all it seems to do is make people more reluctant to move, to get up, to exercise, to walk, for fear that they'll eventually expire their joints. As mentioned before, osteoarthritis is an inflammatory disease at its essence, and this is something that doctors haven't been getting out to our patients enough. Addressing the causes of inflammation are essential, and similarly, moving, exercising, strengthening throughout the joint are essential to help reduce our pain and to slow down the damage that we see on imaging as well. There's so much more to say about osteoarthritis, and my intention with this series of videos is to start touching on specific management approaches and how I can hopefully deliver the information to empower the patient to take over their condition themselves. Please remember, if you have any issues, you have to see your doctor. This isn't medical advice. It really has to be tailored to each individual, just like I do in these rooms when my patients come in. If you found that useful, please give it a like. Please subscribe. There's plenty more content on its way. And if you've got any ideas about things you want to learn more about or questions, anything that I can help explain, please drop it in the comments below. Until next time, stay active and stay healthy. Thanks.